Hey guys, what's up? It's Dr. Ashton Sid here with Mind Media Psych. Welcome to TikTok Live with Mind Media Psych. We are here Monday through Friday, 6 to 6:30 p.m. And we are board certified adult and child and adolescent psychiatrists who treat children, adults, older adults with psychiatric medication and therapy. We're happy to be here. This is part of our series where we talk about topics that people are really interested in. The big topic that we are talking for today is ADHD medications. So I'm going to kind of go over what are medications that are used to treat ADHD and kind of define what ADHD is, and then talk about, what I think about in management with these things. Every medication has side effects, and anything that I provide or offer today, just use it as a tool to talk to your doctor about if you are on an ADHD medication or think you have a diagnosis of ADHD. I'm a guy on TikTok. I'm not your doctor. So it's important to use this as a way to educate yourself. If you can, like us, follow us, whatever you can, because it just means that we'll get more promoted and we'll try to provide more evidence-based education regarding psychiatry, mental health, all that good stuff. All right, so let's talk ADHD meds. So ADHD, or attention deficit hyperactivity disorder, is one of the most common psychiatric conditions we see in psychiatry. We see it in children and adolescents often because it's what we call an externalizing disorder. It often is appearing in the young children, young boys. We often see it more initially, and then girls can have typically the inattentive symptoms, but they also could be hyperactive. But we often see the young boys who are kind of all over the place in the schoolroom who often get diagnosed more. And in those certain conditions, situations, what are we looking for in ADHD? Well, often we're looking for impulsivity, hyperactivity, difficulty tolerating any type of repetitive tasks or boring tasks that children or teens or adults have to do, difficulty sitting still, fidgeting significantly, difficulty with being able to control impulses, or difficulty in controlling kind of regulation of those impulses. And often we can see this leading into functional issues in the classroom, particularly amongst peers, amongst teachers. These students can often, in the hyperactive impulsive place, can often be put in detention, made to sit in the front of the classroom. Often they are ostracized by their peers or not liked by their peers, things like that. So that's just like kind of the general kind of hyperactivity, impulsivity. In inattentive types, it's often daydreaming, often finding yourself unable to concentrate on things for an extended period of time, unable to switch tasks or jump from task to task. We often all have inattention. That doesn't mean we all have ADHD, but it is very incredibly difficult for these patient populations. And so we often have to, from a child and adolescent psychiatry standpoint, what we do as clinicians is we first start with screening. So the typical screening tools that are used for ADHD include the Vanderbilt scale, the Connor scale. These are scales that we use to diagnose ADHD in kids. And these scales, to diagnose ADHD, has to be in two settings. So often people think, I have all these symptoms, but all these symptoms might become much more pronounced in one setting than the other. Well, we want to make sure we're getting data from everywhere. So often when we see parents who have children with ADHD, we send them a scale to take back that they have to finish, and then we send a scale to their teachers, typically all 5 or 6 teachers they have during the day, and we get an average number of all these types of symptoms. And the reason why is because we want to make sure that their symptoms that they're having are happening in all different domains. Because often ADHD can be misdiagnosed, and it can be often something else because it's not popping up in one area or one kind of like environment. And that's something that we kind of want to look for in the discrepancy. So there are, when we're dealing with ADHD or attention deficit hyperactivity disorder, we often think, how do we treat this, right? Because it can lead to all these significant things: worsening substance use or risk of substance use, peer rejection. Comorbid psychiatric conditions often do occur with ADHD as well. And so we jump and we think about medications, right? There are all different types of medications out there that treat ADHD to help with the hyperactivity, help with impulsivity, help with inattention. And often, people say, well, let's try behavioral management first and therapy first. It's really fascinating the amount of TikTok coaches I see on here with ADHD, executive function, and things like that, because a lot of the data that we have in psychiatry and in psychology in general is that Stimulant medications often improve. The adage in psychiatry is, right, therapy plus treatment often leads to improvement in overall symptoms. But in ADHD, strangely enough, stimulant medications, even without therapy, lead to better results than therapy alone, for ADHD symptoms in particular. So if a child has very significant symptoms of ADHD, I often won't recommend just therapy initially to start out. I will often recommend a stimulant medication or a medication in general. Now, it's very strange, right? Because typically when I have somebody who comes in with mild depression or moderate anxiety, I'm often considering cognitive behavioral therapy or some type of therapy to kind of work on these things. But with ADHD, it can be dangerous, and also additionally, we have a lot of good data that ADHD medications do really well for what they treat. Our efficacy rate in terms of people with ADHD means that about 3 out of 4 people who have ADHD respond really well to their medications. Compare this to 1 out of 3 with antidepressants for depression. So it's really, really good. It's one of our best medications for what it treats. Now, the biggest thing is that, when you're looking at kind of all these different type of medications and things like that, like what do people typically often use for ADHD? Well, typically the first line agent is what we call a psychostimulant. A psychostimulant, and this sounds like an oxymoron, right? You would give a stimulant to a kid who has ADHD. That doesn't make much sense. Well, think about a stimulant as it acts on a part of the brain called the prefrontal cortex. The prefrontal cortex is kind of the control center of our brain. It helps us with impulsive decisions and regulating those decisions, shifting tasks, shifting orientation to tasks, concentrating and focus. And that part of the brain is basically in hyperactive overdrive in kids with ADHD, and its connectivity to other parts of the brain isn't well connected. So stimulants basically kind of help calm that part of the brain, and they stimulate the parts of the brain that act as brakes in the prefrontal cortex, that act as basically energizing the brakes of your brain. So think of like you're going a million miles a minute. These give power to the brakes. They stimulate the brakes. So we call them stimulants. Now, stimulants come in all different classes, right? Two main different classes. The 2 main classes that stimulants are in that treat ADHD are methylphenidates and amphetamine-based classes. Methylphenidate classes are your typical Ritalin, Concerta, Daytrana, all kind of different types of medications. And then your amphetamine-based class are typically Adderall, Dexedrine, Vyvanse. These are the amphetamine-based classes. Now, somebody asked, do ADHD meds help OCD? Typically, they actually worsen OCD. They can cause irritability and anxiety. And I'm going to talk about side effects because on all of these lives, I really highlight side effects of medications because I just want to kind of over and over again tell you that no matter what med or herbal supplement you take, it's a quid pro quo. There might be a side effect that you're not aware of, and you should know about it before you start a medication. And always talk to your doctor about that. So when we talk about these stimulant medications and how they work, right? They activate the prefrontal cortex, those brakes in your brain, they stimulate them. And methylphenidate medications are often the first line medication that I give in my practice. Some other doctors may not, but I typically do because a lot of the meta-analysis studies show that medications like Ritalin and Concerta can sometimes have a little bit less side effect profile and easier to tolerate in children and adolescents. This is just my style of how I practice. Now, these medications include things like Concerta, Ritalin, and once you make a decision on what medication you choose to do, you ask yourself, are you going to be a short-acting or a long-acting medication? Stimulants come in short-acting and long-acting versions, and there's really importance to differentiate between both because there's a reason behind why we want to differentiate. Children, for example, are not little adults. They have different ways they metabolize medications, they get rid of medications. So it's super important that you understand the physiology of what happens in children and what happens in adults. And somebody said what class works best for adults. We do have data that amphetamine-based classes can be a little bit more effective in adults, but honestly, going with one or the other, they're very effective at what they do. So there's always a quick trial. And so children can metabolize medications really quick. So what you would often find is that they'll be dosed once or twice or 3 times a day with medications because they feel the effect and then it's gone. So it's important to understand why you're giving a medication and what type of medication are you giving. Are you giving a short-acting or a long-acting form? Majority of the time, people will start with long-acting forms of the medication because they're easier to tolerate. So that could be in the methylphenidate class, something like Concerta, or Ritalin long-acting or sustained release. Because sometimes we can see, okay, the side effects are a little bit easier to tolerate, and we can see over the weekend when we try that, are they having the side effects such as, and I'll talk about this more, but appetite suppression, insomnia, headaches, irritability at the end of the day, okay? And so, and I do take questions. I'm going to stop halfway or in 2/3 of the way just so that I can come back and cycle through this. So basically, when we're thinking about short-acting versus long-acting, right? Typically, long-acting is a little bit more practical when you take it. Can last throughout the duration of the school day for kids. It addresses what we call tachyphylaxis, so the idea that you tolerate really quickly. These medications, if you take them every day, it can actually build a tolerance a little bit better. And the other aspect is that it decreases the stimulant rebound. What does that mean? Well, people who are sensitive to the crash at the end of the day, the long-acting stimulants can help with that. So then why would we do short-acting stimulants? Well, short-acting stimulants are basically, they work for a few hours, so it's good for people who maybe might have to take a test or might have a half day of school or have an afternoon of completing homework that they need to get done. Appetite suppression on these medications of short-acting can be a little bit less compared to the long-acting. And then they, as I talked about the side effects, is stimulants can interfere with sleep. So let's talk about side effects, right? We've talked about methylphenidates and those types of medications. We talked about amphetamines and Vyvanse and Adderall and those type of medications. They're both stimulants. They both treat the same thing. They're both effective, but they both have typically the similar side effect profile. What are the side effects of stimulants that people need to be aware of? Well, first and foremost, when kids start this, we want to be really careful because they can cause significant appetite suppression. When kids are growing, they need to eat, and stimulants can decrease the appetite throughout the day. So we want to make sure that they have a big breakfast when they eat or take a stimulant. And it can be really off top. They might not be breakfast eaters, right? They might not want to eat, but it's super important. A big protein shake or something like that is what I often advise my own patients when I talk about stimulants. The other thing that I often talk about, and I'll talk about Vyvanse in a little bit, is insomnia. Long-acting stimulants can often cause insomnia, and so that's really, really important that we kind of look out for those things, right? Because it can cause you to not sleep. And if you don't sleep, you might feel more inattentive, right? So it's like, the ADHD is not working. The other aspect is that they can cause anxiety or irritability. Often people who are over-medicated on stimulants can feel really anxious, feel really restless. They can worsen also tic-like behavior, or like movements in your hands, movements in your legs. I've had people complain about this before where they'll be at night, they'll be laying in bed and they're like, I can't stop moving my hands and feet. And that can happen with stimulants. The other aspect with stimulants is that they can cause a little bit of a crash. So you take your stimulant, you're feeling good, it's 4 or 5 p.m. at night, and then you start feeling tired, and you start feeling this drag, and you start feeling this low mood. That can typically happen, and there are ways to combat that. I often recommend to people work out. Go exercise for 30 minutes during that time. The endogenous opioids that are released will help your mood significantly and help with the irritability. There's also supplements such as L-theanine, which can help too. So those things are typically helpful. The other thing that people don't talk about a lot is that stimulants can dry you out, meaning they can cause dry mouth. And the reason why is they decrease salivary production. Well, why does that matter, right? Decrease my saliva, that's okay, right? Well, saliva protects the enamel of your teeth. And often people with stimulants can have more and more cavities because there's not enough saliva being produced. People also said lower seizure threshold. They can lower the seizure threshold. So if you have a seizure history, you gotta be a little bit careful with stimulant medications. And so these are like the overall things that I kind of think about with stimulant medications. The other aspect that's not talked about as much, and you know what, I think it's a little bit overblown. There is an abuse potential with stimulants, particularly with short-acting stimulants. Anybody that's a substance use history that comes into my clinic, I don't say you can't have a stimulant. That's not how that works. It's often that you want to start a long-acting stimulant. You want to be very careful about what you're treating and why you're treating that. And so you really want to be it doesn't mean it's a contraindication. Often people who have a substance use disorder might benefit significantly from a stimulant. We often prescribe Vyvanse to patients who have severe substance use disorders because you can't snort Vyvanse. It doesn't go through the blood-brain barrier that way. It has to be digested through the stomach. So all these cool little facts here. So people are saying, I feel the crash the next day. That's very much true. The other aspect that I want to kind of talk about, and that was brought up a couple times, is drug holidays. So stimulants can cause in your body tachyphylaxis. And what is tachyphylaxis? It's basically you developing tolerance over time to them. And they can happen typically pretty quickly. So it's important that, if it's a kid who's on a stimulant and they use it for, difficulty paying attention and concentrating, if it's the weekend and they don't have that much homework, don't take the stimulant on the weekends. If it's summer break or winter break, take those breaks off. If you're a functioning adult and you use it, don't take it on the weekends when you're not working. That's typically the best way. You will deal with a little bit of crash, and that is the quid pro quo behind these medications, but it's important to know about, in general. I've seen a lot of questions about Vyvanse. Vyvanse is a long-acting stimulant in the amphetamine-based class. It can last up to 12 to 14 hours. It's pretty expensive, but I believe generic is here or is coming soon. It's capsules that are it acts like a prodrug. So you swallow it, it goes into your digestive system, and the moment it hits the stomach acid, there's a lysine attached to a dextroamphetamine salt. And so the lysine is basically broken, and the dextroamphetamine is released. And so that's the biggest thing that happens. And then it's slowly released over time. So often people find it helpful if they have serious side effects to the other stimulants. It can be expensive though. Out of pocket is roughly $300 to $400. So having your insurance cover is important. Somebody brought up guanfacine. Great. Let's get to non-stimulants. So say you're a child and a teenager, an adult, and you're like, every stimulant I try, horrible appetite suppression, feel like I can't sleep, I get super irritable. Then there are non-stimulant medications. These are medications that don't work in the same way that the amphetamines and the methylphenidates work, but they can help with focus and attention. They're not as effective, but they won't have the side effects as much as the stimulants. Which ones are these? Well, these include things like guanfacine or Tenex, also known as Intunif, which is the long-acting form of guanfacine, clonidine or Catfay or Catapres. So what are these medications? Well, guanfacine, I believe, is an alpha-1 antagonist, and clonidine is an alpha-2 agonist. The idea is these are blood pressure medications, but we have found that they do reduce hyperactivity, reduce anxiety in patients, and they don't cause the weight loss and the insomnia. In fact, they can cause sedation and get you a little tired. They can cause you to feel groggy. They can cause you to have rebound hypertension. So again, super important to have a conversation about with a doctor, but these options do help for individuals who have ADHD and cannot tolerate a stimulant. Another non-stimulant is called atomoxetine or Strattera. This is an NRI or norepinephrine reuptake inhibitor. It has been used for treatment of ADHD and for people who can't tolerate it. It is often can cause a little bit of nausea. I think there's a black box warning of like liver hepatotoxicity, but you have to, it's very, very rare. People do like taking this medication if they can't tolerate it, but it's not as effective. It's not my first line often with ADHD because stimulants work really quickly, and if you can tolerate the side effects, they work within 1 to 2 days. So you can get an idea really quickly. Not like an SSRI, which take 6 to 8 weeks to work for depression, right? And if stimulants work really well, great. If Strattera works really well, fantastic. I mean, that is great, right? You want to figure out what's the best medication for you. So, we've talked about guanfacine, we talked about clonidine, we talked about Strattera. So these are kind of like the overall medications, right, in amphetamine-based kind of things that we think about. They're all dosed differently. So when you think about dosing from amphetamines to amphetamines, Adderall immediate release, Adderall extended release, they're equivalent. So you're not really jumping in potency, you're just jumping in how long does it last for. And so actually I'm not going to go too much into conversions because I think that's a little complicated for tonight. But what I'm going to do now is I think I've talked quite a bit. I'm going to take some questions from the audience. And if you guys can, I'm trying to get my computer on because I need to look at the time too. I can only go till 6:30, but I'm going to start answering some questions, okay? All right, so I'm going to start up here. When is it recommended to take both non-stimulant and stimulant meds combined? I don't often see that often. One of the things I do notice is that if somebody has severe aggression and they need to be on their stimulant medication, stimulants can worsen aggression. So I have sometimes seen a stimulant medication and then guanfacine added, which is a non-stimulant, to help with aggression. Both are agonists. Thank you for letting me know. Sometimes I mess up. Nuvigil just made me sleep, so it didn't help in the background. People are talking about lowering blood pressure with guanfacine. Yes, it does. Absolutely. Strattera is horrible. Some people don't like it. Supplements. Do supplements work? So there are supplements. Remember, supplements are medicines. They can work, but they have side effects. A lot of people talk about L-tryptophan. L-tryptophan is a kind of a, L-tyrosine. L-tyrosine is a precursor for dopamine, norepinephrine. Often we find that the stimulants work with. The duration of action of L-tyrosine is not long. It's like 2 to 4 hours. But people like it, especially when there's a shortage, and they can kind of supercharge the stimulant. I'm trying to think of other things. Saffron have a lot of data and evidence for it. I've never dosed it ever in any of my treatment, so but it's something to think about it. Let's see. Thoughts on taking stimulants with anti-anxiety meds? It depends. You just need to be kind of in medicine, it's always a quid pro quo. You always have to be a little bit kind of like weary, right? And so stimulants with anti-anxiety meds, stimulants can worsen anxiety. And so if you're taking benzodiazepine for like panic attacks and then you're taking a stimulant, you have to kind of understand, okay, how much of the stimulant is worsening my anxiety? That's typically when I'm thinking, you need to be on a long-acting stimulant, or do you need to be on a non-stimulant for ADHD? Just because the worsening of anxiety with a stimulant can be really debilitating. It can feel really kind of like you're on edge. I missed the info about guanfacine. You know what? I'm gonna help you out here. I'm gonna go to my notes and give you directly the data, just so that you can feel. Okay, so guanfacine, right? Guanfacine, it can be used for as a non-stimulant. It's given FDA approved for 6 to 17 years olds for extended release. It's also FDA approved in adults, but for hypertension when you treat it. It is basically used to treat ADHD and anxiety. It can also be used for insomnia. It comes in an immediate release dose. It comes in an extended release dose. Most common side effects of guanfacine are that they are dry mouth. It can cause you to feel tired, sedated. It can cause you to feel a little dizzy, sometimes constipation, fatigue, and headaches. And the rarest things that you have to worry about is your blood pressure if it drops, hypotension. It's a central acting selective alpha-2 agonist. So somebody said they're both agonists. Thank you so much for that. Alpha-2 adrenergic agonist. I think I was thinking of prazosin earlier. There is some good data. What they looked at is that they also treats generalized anxiety disorder, and so that's helpful, and insomnia. The immediate release and the extended release are not interchangeable. You have to kind of figure out how to appropriately titrate and taper them. And then kind of looking at overall things, when you get off guanfacine, you just have to be a little bit gentle with it because you don't want to cause that rebound spike and increase in blood pressure. So yeah, that's the overall idea. The bottom line about it, it doesn't worsen tic disorder, so it doesn't worsen tic-like movements. There's a lack of an abuse potential, and there's no insomnia with it. However, it does have a delayed onset. So while stimulants are like 1 to 2 days, right? It takes about 2 to 4 weeks for guanfacine to really kick in, and you have to take it every day. There's no drug holidays from guanfacine. The extended release is available in generic, and it's typically easier to use than the immediate release. And yeah, talked about insomnia and anxiety with it. Hopefully that was helpful. All right. Negative long-term effects of stimulants. Great question. So we actually don't know the long-term data on what the brain looks like when you've been on a stimulant for multiple years. There are psychiatrists on here that'll say, oh, well, we don't know, but you should still be on it no matter what. And I'm one of these doctors who say, listen, your functionality is important, and if you're functional without a stimulant and you're doing well, great, don't be on it. We want to look at functionality overall because we don't have the long-term data of what our bodies look like. What we do know is that the short-term side effects can build up over time, right? So if you're chronically having bad insomnia, that's going to affect your mood, that's going to affect your memory. If you're having chronic appetite suppression and you're a kid, that's going to affect your pubertal onset. That's going to affect your growth. Right? If you're having complete dry mouth over and over again, that's going to cause you to have an increase in cavities over time if you're not properly hydrating, right? And your so those are kind of like the big things I think about in the long term. How different would the meds be for ADHD versus ADD? Diagnosed with ADD, meds don't different. They're not different. Do you prescribe armodafinil? I'm guessing you're trying to say modafinil. I don't typically prescribe it because in kids that can have an increased risk of what we call Stevens-Johnson syndrome. Modafinil was a medication. It's an old medication. It's not actually considered a stimulant. It's often used as a medication to treat narcolepsy and shift work for individuals, but it can be used for ADHD. I take L-theanine to help with the come down, with the crash. Yeah, L-theanine is often prescribed. It comes in 100 and 200 micrograms. It's seen in pharmacies. Talk to your doctor about it if you're thinking about taking it. What do you think about QB tests for adult diagnosis, since we can't really... I don't know what a QB test... I think you're thinking about... I think I have that. The data for it isn't strong, actually. I think I talked to Dr. Koja Sarfo. He's one of another... he's an NP on here who has like 1.5 million followers, and we text all the time back and forth about data on this stuff. And I think we talked, like, it doesn't have a lot of strong data. Appetite suppression ever getting better. Been adjusting doses, trying different amounts for years, and still struggle. That's really, really tough. Again, thinking about the non-stimulants as a possibility. Thoughts on Quellbri? How does it compare to amoxicillin? Quellbri, let me go to my notes about that, because I never prescribe Quellbri. One, because it's super expensive, and I'm often like, why would I prescribe this medication? Hold on one second. It's in here. I want to give you guys the right data, so that's why I want to make sure that I talk about it appropriately. Yeah, it's a newer medication. I often don't prescribe it just because there's no data that it says it's better than one or the other. And it's expensive. So I'm sorry I can't give you more about that. Cardiac issues from long-term? Yeah, that's a great question. So often, if people have structural cardiac disease and they're like, it's pretty severe, or have a strong family history of cardiac disease, I'm often very much like, let's go talk to your cardiologist before we prescribe a stimulant, just because stimulants do increase blood pressure, they do increase heart rate. The overall blood pressure increase isn't significant. It's like 2 to 10 millimicrograms on the systolic blood pressure, and the heart rate does increase, but often, majority of the time, it's not an issue. So I'm often kind of like, if you don't have a cardiac history, if there's no structural heart disease, there's no kind of long-term thoughts about it. All right, guys, I've done my best. Trial for a kid to do with ADHD. I'm glad we're going for the trial. What are your thoughts on natural alternatives like lemon balm, for example? I don't really have strong thoughts on herbal supplements in response to stimulants. There's not a lot of strong data that says, oh, you should take this type of herbal supplement. Stimulants are one of the best medications in psychiatry because they treat the disease or the illness very well compared to other issues. All right, guys, I gotta go. Gotta run. Hopefully this was helpful. Just my just wanted to appreciate all your questions, all the thoughts of like what you brought up. Again, I'm Dr. Sood. I'm a board certified adult and child and adolescent psychiatrist to treat all these types of things. Please, 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 please follow us. The more you like us, the more you visit our page, the more attention we get, the more we can provide evidence-based knowledge about this. We are not working with big pharma. We don't sell anything. We are not even working with brands at the moment. We just want to provide appropriate mental health education on this platform. However, I am a guy on TikTok. I am not your doctor. And so what's really important is when we are talking about this on TikTok, use this as a tool to learn more. And then if you make a medical decision, make that medical decision with your doctor. Make it with your therapist. Do not make it after listening to anyone on TikTok, okay? Because it's super important that even though there's a mental health disparity, you have this conversation with a person who knows you well, all right? It is such a pleasure hanging out with you guys. Next topic, now what? Strategies for kids. Love it. That could potentially be a topic to talk about. We're going to start back on Monday at 6 p.m. And so leave comments on our videos of what you would like to hear, what you'd like to know. We've done sleep meds, antipsychotic meds, ADHD meds. We haven't done mood stabilizers. We haven't done antidepressants. So tons of things, okay? All right. Good luck to you guys. Have a wonderful New Year. Happy New Year. All right. And see you guys later. Thank you so much.